This is the Politics for Real talk show. I'm Brianna Campbell, your host. This episode is entitled Healthcare in the United States. Question: why isn't one of the world's most developed countries the biggest advocate of universal healthcare? Does the United States government really expect 30 million Americans to get insured? Well, for years, the United States government has deprived Americans of the health care they deserve. And what's worse, our country has one of the most expensive health care policies in the world, costing about $10,000 per American. Leaders in the United Nations believe that failing to provide universal health care when it's in the means of the United States to do so is, I quote, morally, ethically, and politically wrong. Guys, it's wrong, and I couldn't agree more. Now, in August, President Donald Trump signed the National Authorization Defense Act, and the National Defense Authorization Act, the 2019 Act, okay? And this particular act, this act authorizes a top-line defense spending budget of $717 billion. Guys, how could something like this be prioritized over universal health care? How? How could this be prioritized over universal health care? Now, it seems to me that Trump has actually put more effort into dismantling the Obamacare plan since he's been in office than actually strategizing a feasible healthcare policy, guys. And actually, since he's been in office, at least 4 million Americans have lost their healthcare coverage. What's going on, America? What is going on, America? Okay, I'm sure that you guys would love to know about what the progressive Democrats are doing, and they are doing something that is profound, okay? Guys, so the progressive Democrats, they are actually they're the ones that advocated for what's known as the Medicare for All healthcare policy, guys. And what this policy does is it replaces the for-profit. What this policy does is it's a plan to actually expand the existing Medicare plan that's intended for seniors, right? And so you're probably wondering, this Medicare for All thing, what is it with this plan? Well, the Medicare for All plan is actually a publicly funded, privately operated healthcare system. And it involves, the ultimate plan of Medicare for All is to provide universal coverage, right? And the ultimate objective is actually to decrease what Americans spend on healthcare per year. Who wouldn't want that, right? Who wouldn't want to save money on their healthcare plan per year? And another very major component of the Medicare for All system is that this system eliminates co-pays and deductibles. Millennials, if you haven't heard your parents actually complaining about this, guess what? In a few years, you might actually be subject to these co-pays and deductibles. So you may want to get on board with what we're talking about here today, okay? And so another component, this healthcare system that the progressive Democrats are advocating for, it's a win-win situation for both physicians as well as the patients, right? So on one hand, okay, so the patients, they're supposed to have more autonomy in the selection of healthcare providers, But then on the other hand, the plan, this Medicare for All single payer plan actually eliminates, it kind of simplifies a lot of the administrative systems. So ultimately that places more autonomy in the hands of physicians, autonomy to treat patients as they would like. So I'm sure that's something that many physicians actually would be on board. They would support that that aspect of the plan, okay? And then, so then you're probably wondering, so what's single payer? You have single payer, and then you have single payer, and then you have Medicare for All. Are they the same thing? Guys, so the single payer system, right? It's actually founded on the basis that many countries believe that healthcare is actually a basic human right, guys. So there are many countries who believe that healthcare is a basic human right. And one of the ways that they guarantee this right is through what they call the single payer system, right? And it's a system to actually replace some of these for-profit insurance companies with a more universal public insurance plan, okay? And so, I mean, if everything adds up, right? If all the facts are there and all the signs are there, then what's the problem? Why wouldn't the Senate and why wouldn't Congress want to move forward with this universal plan, guys? I mean, because as of now, and I'm not sure if you guys are aware, millennials, but 70% of Americans are on board with this Medicare for All plan. That's right, guys. 70% of Americans are on board with it. That's like I believe that's 85% of American of Democrats, and that's about 52% of Republicans. So then what is it? What is it? Because the current system isn't working, guys. So let me tell you guys about the current system. The current healthcare system we have, there's a major issue with the incentives, guys. But I'll tell you about that later. So the controversy surrounding the Medicare for All system, guys, it's the cause. It's always the money. Of course it's the money. But it's like, I believe that is so irrelevant because what we're spending now on healthcare, it's about we're spending $3.2 trillion a year on our current healthcare plan. We're spending $3.2 trillion, guys. This plan that the progressive Democrats are advocating for only calls for about $2.3 to $3 trillion a year. Okay, that amounts to about $13.8 trillion over the course of 10 years. Okay, now when you consider the 3.2 that we're spending to their 2.3, then how could we not? How could we not advocate for this plan? Okay, I'll tell you why. Because we haven't considered where our funds are being allocated. We haven't properly allocated our funds. But guess what? I'll tell you, millennials, this is what's going to have to happen. An expansion of federal funds, guys, of this federal spending, it's inevitable. Okay? It's very crucial. But guys, guess what? It's not impossible. We have to expand our federal spending, but look at it's for greater good. It's for the greater good, for universal health care. There is nothing that could be more relevant. There's nothing that could be more important to me, and I believe to many of millennials than universal health care. There should be nothing more important. Okay, so this is what I'm going to do. I'm going to leave you guys with an explanation of what is actually going on with our current system. So the dilemma with our current system, what you guys are probably wondering. So what's wrong with the healthcare we have now, guys? It's the incentives. Okay, these insurance companies, they are concerned with profit. A lot of these insurance companies that we have now, they're more concerned about making a profit than they are ensuring that the patient receives the care that they need and that they deserve. And so what you have is a system that has to be reformed. There is reform necessary, okay? And so what you're left with is a major tensions, just major tensions, between the provision of healthcare and then the goal of maximizing the system. How can you do that when the incentives of these health insurance companies is not right? Okay, the incentives are all wrong. So I think that our healthcare system, and I believe what many millennials would stand by me with this, is when I say that our healthcare system craves, okay, the American healthcare system craves a policy that prioritizes the patient over the profit. Okay, I'll say that one more time because I don't know if you guys caught that. Our system craves a policy that prioritizes the patient over the profit, guys. It's not always about money. Sometimes the lives of Americans matter. Sometimes the lives of the Americans matter. There are people out here who are filing for bankruptcy. They're filing for bankruptcy and they're not able to afford their homes because they're having to factor out everything that the American dream that Trump promises them is possible. He says that America's so great. Then if America's so great, then why are your people having to file for bankruptcy? Okay. Americans are filing for bankruptcy and hospitals are on the brink of collapse. Okay, guys, I just want to leave you guys with those few points right there. If you guys are not convinced enough that that the Medicare for All system is the way to go, that the universal health care is the way to go, then I don't know what else to tell you guys. I really don't. I don't know what else to tell you. I want you guys, I want to get a debate started. I want to hear from you millennials. What do you guys have to say? Okay. I mean, if I told you that the single payer system could eliminate it could decrease the amount of Americans that are having to file for bankruptcy, right? By decreasing their spending on healthcare.